For my grassroots advocacy project, I had the opportunity to research and support policy HB 81, which is Medicaid school-based services. What this particular policy does, it would provide additional funding for children who are in schools who already qualify for Medicaid. By providing school districts, private and charter schools, additional funding, this would provide an access to services otherwise children would not be able to access. Things such as physical therapy, occupational therapy, speech therapy, behavioral health, mental health, and transportation services. This particular funding and policy would create expanded benefits for children that are already qualified for Medicaid. Children previously would only receive services if they had an individualized learning plan or specific learning disabilities. But now it's going to expand program funds for children across the board, whether or not you have an ILP. This will provide children of lower economic statuses an opportunity to access services that they otherwise might not be able to access. Schools are a neutral area for everybody to be able to access help and support that they otherwise are not able to. So by providing additional funding through Medicaid to these schools who qualify, that every child would have an opportunity to access and have those needs serviced in a very safe and comfortable area. I feel like this policy is especially important when we consider this growing social justice issues in our country, as well as the traumas that our children are facing in schools. We have more violence in schools. We have more children exposed to impoverished areas, and they're reeling and they need help with mental health services specifically. As of right now, 60% of children are experiencing mental health needs that have gone unaddressed. And by providing schools additional funding, such as mental health services that will be afforded through the expansion of these Medicaid benefits strictly for school use, it would help support social workers as well as guidance counselors in their ability to provide care to these students in need. But not only that, it would ensure that every child would have access to see a mental health counselors. As we know, children that come for lower socioeconomic statuses that do qualify for Medicaid, they have more barriers to care. Sometimes their parents are not able to take them to these appointments. They're not able to have access to transportation that would ensure that they would be able to complete these necessary services that would overall help their ability to engage in classroom settings, but more importantly would ensure that they would grow up healthy and strong emotionally, mentally, and physically. So as we see our social climate change, it's important that we give every child the opportunity to heal, to be whole, but more importantly, be equipped with the tools necessary to thrive. And HB 81 would do that. So I would ask that our policy officials consider the needs of every child, consider how providing federal funding to private charter schools and public schools will provide a better opportunity for all Florida children. I'm happy to say that when I researched this policy and advocated for it, it was still in the works, but since the 23rd of June, it actually has been passed. So what this would provide is $51 million more for services within schools in Florida for those children that qualify for Medicaid. There will be the expansion, like I mentioned, of physical therapy, occupational therapy, behavioral therapy, as well as a slew of other services that children otherwise would not be able to have gained access to. So I'm very happy to see that our legislature has supported our students, have supported our teachers, have supported social workers and guidance counselors who are all here to make sure and ensure that the next generation has access to everything that they need to thrive. So HB 81 is in place, and we know that our children will be able to thrive. So I'm so glad that we as a body have asked our officials to consider the needs of our children. Not only did they consider it, but they also listened. So Medicaid school-based services are here in Florida.